Hi everybody, welcome to another Tech Talk with Chandra. One of the questions we get all the time is how do I administer subcutaneous fluids to my pet? So I'm going to show you today how to set up a bag, how to set up the line, and how to get started. Okay, so first here we have our bag. This is saline. Your vet will prescribe whatever fluids are needed for your pet. So to open the bag, you just open the plastic. And I usually check just to make sure the bag's intact first, like make sure there's nothing leaking and this cover should still be on. If there's any leaking, you do need to get a new bag because it won't be sterile at that point. This is the line that comes with it. There's different kinds of lines as well. So this is what the line looks like. This here is the rollerball clamp. So when it's clamped down, it actually closes the line. It prevents fluid from going through, okay? This end of the line is where the spike is. So we're actually going to be taking this piece off, keeping it clean and spiking it into the bag. This is the fluid chamber where we're going to be able to see the drops come through. And then this is a port. Don't worry about that for now. You can use it to inject into. And this is the very end of the line that we're going to focus on trying to keep this clean and sterile. And we will put a needle on this end. So to spike the bag, you're going to first take this plastic piece off. It takes a little bit of elbow grease, and then you want to try to keep everything clean. So try not to touch this or that. And you're physically going to push the spiked end into the bag until it breaks through the seal. All right, so I have the bag here, but we need to prime the line or bleed the line, however you prefer. So the easiest way to do that is to get the bag up high. Gravity is always our friend in this case. So it has a handy little hole here at the top, and you can use a coat hanger or if you have a hook, basically anything that will hold it up. And then you can hang it up high either over a shower rack, a curtain rack, if you have a cupboard like this, just to get it nice and high so it's easier to read the levels as well. And then we don't want any air in our lines. It's not as important for subcutaneous. If you have a few tiny bubbles, it's okay, but for IV, you definitely want nothing. So our goal is to get the fluid all the way through the line to the end without losing a lot of fluid, obviously. So to do that, I'm just going to unclamp this, the rollerball clamp, and you'll start to see the fluid dripping. And I'm going to take the cap off of this end as well, and it's going to start shooting out when it gets to the end. So we'll see, you can almost see now the water coming through, the liquid coming through. So once the line is primed, I just check the port because that's usually where the bubbles hide. Give the port a good flick, and the bubbles will go up. We'll do another little bit. And for that, make sure you clamp this really hard down because you don't want anything to leak out, and some lines don't have an additional safety clamp. So push this all the way down, and now your bag is set up for use. Okay, so now that you have your line primed with minimal air bubbles in it, we are going to put the needle on. So don't be intimidated by the size of the needle. Most vets will recommend 18, maybe 19 gauge. The needle is a little bit big, the gauge of it, but it doesn't make any difference when you're actually doing the poke. It doesn't feel any different to the animal. It's just a quick pinch. And if you use a smaller needle, it's going to take a lot longer to go. So ideally, we want a larger gauge needle so the fluids flow nice and easily, and you can be done in a couple of minutes. So for the needle, you want to try to open it without touching the inside of the needle. So you want to try to keep it clean. So the way to do that is just peel the wrapper and then use this clean end, and they have sometimes a different way to connect. Sometimes there's a little connector on top that you need to spin. This one doesn't have that. So you just want to attach it firmly. Don't attach it too firmly because it will be difficult for you to get off, and it's a sharp needle and you don't want to be poking yourself. So you want to put it on just firmly enough that you can easily take it off later as well. And when you're actually going to go poke, what's going to happen is the needle, the colored part, will stay on the line, and you're going to be pulling the cap off in a straight direction like that. To recap the needle, we always recommend using a one-handed recap as well, just so you don't accidentally poke yourself. So you're going to try to put the cap on with one hand and then use the side of it to push it down. Don't push it on the end. Okay, so when you are getting ready to do your sub-Q fluids, you want to find a location. So some cats are very squirmy, and it might be an easier idea to do them on the floor in your lap. If your cat's amenable to it, you can sometimes do them on the counter. So you want to get them nice and relaxed. You should try to be in a good headspace yourself. And basically what you're going to do if you're doing it yourself is you're just going to have the animal in a comfortable position. And I like to face my needle towards the head, especially with cats, so that if they do try to take off, the needle will just slip out. So what I would do at this point is I'm going to uncap my needle. I'm going to be trying to give the cat some positive affection here. And I'm going to use a scruff with one hand. And then I'm going to create a little pouch here. So I'm going to be aiming to go right in there. And it's going to be a 1, 2, 3 poke. And then I would start the fluids at that point. Good job. Oops. Good job.
Gentle and slight readjustments are usually tolerated well, but for some pets, the movement can cause them to try to run, so always be prepared.
Okay, so for many of our patients, we end up doing subcutaneous fluids on the floor. It's just easier because we have that leverage. Gravity definitely helps because it makes the fluids go a lot faster. And if we need to at that point, I can also use my legs. I can adjust how I'm sitting to hold our kitty here. All right, so if we're gonna be getting ready to do fluids, I can try just doing it with him sort of in front of me like this, getting a good scruff and poking. But if he's going to be very wiggly, I can then sit cross-legged. I can use my legs to help hold him. And I can even use a towel to burrito wrap if needed as well. So generally we like keeping them kind of close to our body, close to the floor, and using a bit of a scruffing motion if you're doing it solo to get to the area where you need to poke. So worst case scenario, what are some of the things that can go wrong when you're giving fluids? One of the things that can happen, and don't panic, is when you accidentally nick a little bit of a capillary on the way out, you might see a few drops of blood. So that means if a bit of the fluid leaks out after, it might have a pink or reddish tinge to it. Don't panic, this is okay. Your cat will not bleed out or your animal will not bleed out. You mainly want to try to pinch to keep the fluids in, but don't panic if you see a little bit of blood. Okay, so one of the other things we get asked is how do I tell how much fluids I'm supposed to be giving my animal, or how do I tell how full the bag is? So when you have a bag that's like this, I don't know if you can kind of see, it's hard to tell exactly where the fluid lines up because there's no air in this bag. So one of the tricks we can do for that is actually turn it upside down, and with keeping everything clean, take the line off, undo the spike, and let some air into the bag, and see how you can see the line across now? So there's now air in the bag, and we're gonna put the spike back in. And now when I turn it upside down, it's very easy to see that line. However, if it's at a bit of a high angle for you and you're trying to see where you're at for your fluids, you can also put tape or stickers right at the lines where you need to mark. That's another easy way to do it.